Millions of lives around the world were saved when the polio vaccine, developed by the Salk team, was officially licensed on April 12, 1955. Before the vaccine was released in 1952, more than 21,000 cases were reported. However, only 61 cases were reported in 1965 after the vaccine was released. This vaccine was without a doubt a turning point in history because it not only saved lives, but was also foundational for the future of medical research. Who owns the patent on this vaccine? Well, the people, I would say. There is no patent. Could you patent the sun? Jonas Salk.
The polio disease has been around since ancient times. There are even ancient Egyptian images that are assumed to depict children with polio. The British doctor Michael Underwood made the first clinical description of the disease in 1749. However, polio was not a recognized illness until almost 100 years later in 1840 when it was recorded by the German physician Jacob Hein. During the same time leading up to the vaccine, polio became the most feared disease in the world.
Franklin D. Roosevelt was one of many who had to withstand polio. During the late summer of 1921, he was shockingly diagnosed after he fell from his sailboat into the frigid Atlantic waters and eventually couldn't even stand. This was surprising because polio normally occurs in children up to 14 years old. This was due to the fact that the disease passed through contaminated waters, and the people that grew up before industrialized sewage systems were most likely immune.
Roosevelt worked hard to regain control over his lower body, but never could. He got to experience some relief while floating in the water at the Warm Springs Resort in Georgia. When this resort became financially unstable in 1926, he purchased it and converted it into a polio treatment center.
Unfortunately, it was segregated, being only open to whites. He set up fundraisers in 1934 to help support Warm Springs in the nationwide research of polio treatment, which are now known as the March of Dimes Foundations. I am not sick, I am broken, but I am happy to be alive as long as I can paint. Frida Kahlo.
In 1916, major polio outbreaks occurred. 2,000 people in New York died. The victims of this terrible disease were depending on an iron lung for survival. A vaccine was urgently needed with the constantly increasing number of cases, especially in children. People began researching and working towards finding a solution. However, we cannot ignore the faults made during the testing process of the polio vaccine. The vaccine was used on children with physical and mental disabilities before it was known to be safe. In 1935, there were studies conducted on children based on viruses grown in monkeys. Several of the children who received this vaccine became paralyzed in the arm where they received the treatment, and some died. People did not react well to this study and called it murder, which caused a setback on more research. After the controversy passed in 1949, there was a step in the right direction. Frederick Robbins, John Enders, and Thomas Weller made the triumph of growing poliovirus in human tissue, getting recognized with the Nobel Prize in 1954.
My mom was paralyzed from polio at the age of 2, abandoned by her husband, left with a 2-year-old, a 6-year-old, and a 10-year-old, and so we were raising her as much as she was raising us, Dustin Lance Black.
When citizens started taking the vaccine, cases of polio in America decreased by more than 99%. Jonas Salk and his team of scientists were the solution. But there was also a second vaccine. Microbiologist and physician Albert Sabin developed the oral vaccine. It was the diluted form of the disease and was given through drops. To make it more appealing for children, it was served on sugar cubes. However, Sabin struggled to test his vaccine, with the Salk vaccine already being used across the nation. In 1956, he began to work in the Soviet Union with Mikhail P. Chumakov, who had previously worked with Salk. By 1959, the vaccine had been determined to be safe and successful.
U.S. physician Jonas Salk created the first successful polio vaccine. According to the World Health Organization, the results were announced on 12 April 1955, and Salk's inactivated polio vaccine was licensed on the same day. By 1957, annual cases dropped from 58,000 to 5,600, and by 1961, only 161 cases remained. When the vaccine was finally released, everyone was greatly relieved with the almost immediate drop in the number of cases.
We're all responsible for creating a polio-free world while we still can. Bill Gates.
The polio vaccine greatly affected the long-term history of our country. By 1994, America was officially polio-free, and by the year 2000, it was no longer present in the entire Western Pacific. The only 3 places where polio still remains are Pakistan, Nigeria, and Afghanistan, and efforts are being made to finally eliminate it. In 2020, polio was eradicated in Nigeria, but different variants have been running rampant throughout the past couple years. The Global Polio Eradication Initiative is currently working to eliminate polio from all areas of the world.
The Global Polio Eradication Initiative is a public-private partnership that is led by the national government. There are 6 core partners, which are the World Health Organization, Rotary International, the U.S. Centers for Disease Control and Prevention, the United Nations Children's Fund, the Bill and Melinda Gates Foundation in Gavi, and the Vaccine Alliance. The main purpose of their partnership is to ensure that polio is eventually removed from the world entirely. Since the Global Polio Eradication Initiative was established in 1988, case numbers have dropped drastically by more than 99%.
Eradicating polio in India, the second most populous country at the time, was a huge achievement in the world of health. They worked hard to make the vaccine available in all cities. However, some people were suspicious of its authenticity. To combat these misunderstandings, parents, religious leaders, Bollywood celebrities, and cricket players were encouraged to spread the word of immunization. The last case there was recorded in 2011.